What exactly is spinal muscular atrophy? And how badly could it affect a person? Stick with us till the end to find out. What exactly is spinal muscular atrophy, SMA? This neuromuscular disease is a hereditary disease that brings on the weakening and wasting away of muscles. Why does this happen? This occurs due to the malfunctioning of motor neurons, which can no longer receive proper signals. So, once this occurs, it in turn causes the decrease in the size of muscles. Hence the word spinal muscular atrophy. You'd be surprised to find out that 10,000 to 25,000 children and adults are living with SMA in the United States. What makes you prone to this disease? Now, the reason this disease occurs is due to either the lack of an SMN1 gene or its malfunction. A carrier adult can contain the defective gene without even knowing it exists. Lucky for carriers, they never contract the disease and rather pass it on to their offsprings. This disease occurs in 4 types to be exact. The first type, type 1, is seen in about 60% of people affected by SMA. It's also called the Werning-Hoffmann disease. In this case, symptoms can be observed as early as at birth or at least within the first half year. These little babies could suffer problems with swallowing and sucking while not being able to hold their heads up. With further progress of the disease, respiratory infections can occur, and in severe cases, lung collapse. Sadly, most affected babies do not even make it to their 2nd birthday. Moving on to type 2 SMA. Tuberous disease. Symptoms begin appearing between 6 and 18 months of age, since the targeted area here is the lower limbs. Children with type 2 SMA can walk. However, they have a much longer lifespan than type 1 affected babies and can even make it to adulthood. The Kugelberg-Willander disease, or type 3 SMA, only causes signs to appear as late as adulthood. Here, the affected person can experience mild muscular weakness and difficulties in both breathing and walking. This isn't exactly the most life-threatening type. The rarest of them all would be the type 4 SMA, which usually affects individuals in their mid-30s. Owing to the slow progression of the disease, the affected individuals live lives full with fewer complications. Let's get a more detailed look into these symptoms. The amount of the functional SMN protein is what determines how mild or severe the disease can get. This applies for all types of SMA. The more the protein, the milder the symptoms. In certain fetuses with type 0 SMA premature births and limited fetal movements can be observed. This causes the infants to be weak, have lower muscular tone, facial paralysis, and even heart problems. Speaking of children suffering from type 1, some more symptoms include never being able to sit up straight on their own. One of the most used means to increase their chances of survival is by providing them ventilation and feeding tubes. In this way, they can be made to live for several years more than expected. Babies around 3 and 15 months are more prone to the type 2 SMA. Though sitting up may not be an issue here, babies have a lot of trouble walking independently. Nearly 20% of SMA cases are these cases, and the target sites include muscles close to the body, particularly those found in the legs. A lot of the affected children suffer from respiratory issues as well, but many children live into young adulthood or longer. SMA type 3 affects about 30% of cases. Some completely lose the ability to walk in adolescence, while a lot of others remain unaffected in their limbs till adulthood. Foot deformities, scoliosis, and respiratory muscle weaknesses are other symptoms noticeable in type 3. In this particular disease types, 1 through 4, it is the proximal muscles that are usually more affected or affected sooner than distal muscles. To give a clearer picture, thigh muscles are weaker than lower legs and foot muscles. That's all for today's video. Thank you for watching. We'll see you in the next one.